Okay, you're turning 65 and you have to go on Medicare. Boo-hoo. Well, it's not so bad. I'm ahead of you. What are you getting when you do it? Well, you're going to get a card, not exactly this size, but you're going to get a card that's going to have hospital on it and medical coverage. Hospital coverage, medical coverage. Hospital coverage is covered under Part A Medicare. Do you have to pay for it? For most of us that have worked more than 10 years and 40 quarters, which is government speak, we will get Medicare Part A for free. But the free part ends there, because if you use the card and get admitted to the hospital, you're going to have to pay some cost sharing. If you go in the hospital for 1 day, right on up to 60 days, or anywhere in between, you're going to have a $1,632 deductible. The 60 days is a critical period because it's considered a benefit period. So if you have to go back in the hospital for the same thing within 60 days, you will not have to pay another $1,632. Go in for something different, you're going to have to pay it. So obviously if it's $1,632 for 1 day right up to 60, if you're in for 1 day, not such a good deal. The longer you stay, the more bang for your buck you're going to get. So stick around as long as you can. Okay, the other part, Part B. Well, Part B is everything outside of the hospital. All right, it's even the emergency room. You're not admitted, so that's going to be covered under Medicare Part B. Bad news, Medicare is not free. We're all going to have to pay a monthly premium for Medicare Part B. This year, for an average person, it's going to cost $174 per month. Some people will pay more because it's also income tested. So depending upon your income, you could pay more than that. Is Medicare Part B free when you use it? No, you're going to have some cost sharing with that too. Medicare Part B has a small deductible of $240, and then after that, you will be responsible for 20% of all costs. Medicare will pick up 80%. Also, Medicare itself, the card does not cover prescription medications. So if you opt to just use your Medicare card as your main insurance, you're still going to have to add a Part D prescription drug plan to it. Now, there's other things that you can add to it, like a supplement, Medicare Advantage. That's a discussion for another day. So right now, you're going to be talking about your Medicare card. Just remember, you do have to add a prescription drug plan to it, Medicare Part D.